Hi, this is Dr. Kingston, and in this video, I will be going over the muscles of the tongue. Our objective here is to name the intrinsic and extrinsic muscles of the tongue, and we're going to discuss their origins, their insertions, and their innervations. The intrinsic muscles of the tongue are what make up a lot of the body of the tongue. So the purpose of these is to change the shape of the tongue. We have two longitudinal muscles. We have a superior longitudinal up here and an inferior longitudinal down here. Their fibers run from front to back, and when they contract, they're going to shorten up the length of the tongue. Vertical fibers, we can see running here, these run up and down. These will flatten the tongue when they contract. And the transverse fibers are a little bit more difficult to see here, but they would run side to side. So when they fire, they will make the tongue narrow. All of these are going to receive motor innervation from the hypoglossal nerve. Then the extrinsic tongue muscles are the muscles that actually move the tongue around within and sometimes outside of the oral cavity. These have connections to both the base of the tongue and to surrounding structures. Right? These are typically named for the structures that they attach to. So we have Palatoglossus, which runs between the soft palate and the tongue and acts to elevate the tongue or to depress the palate. We have Styloglossus, which is another tongue elevator, and that is going to attach up to the styloid process of the skull. You can actually see this a lot better here on the drawing, the illustration, than on the photograph. So here's where it inserts on the base of the tongue, comes all the way up to that styloid process. Okay, here's stylohyoid and stylopharyngeus, just for your reference. Our next muscle here then is going to be genioglossus. We talked a little bit about genioglossus before. It attaches to the genial spines, which are spines on the interior surface here of the mandibular body, and that will make a fan as it extends out into the body of the tongue. So when that contracts, it will pull the tongue forward or protrude it, and it will also deviate the tongue to the contralateral or the opposite side if it's fired unilaterally. So if you fire it just on your left, your tongue will protrude and stick out to the right. All right, our last extrinsic muscle here is hyoglossus, which attaches from the hyoid bone to the base of the tongue, so down here, and up to the base of the tongue here. So this whole big flat guy is hyoglossus. And that will pull the tongue downward or depress the tongue. This is the muscle that you fire when your doctor tells you to say, ah. So I imagine you will get a lot of use out of this muscle in your career as a dentist. All right, one of the nice things about this group of muscles is that they almost all of them share the same innervation. So the hypoglossal nerve, or cranial nerve number 12, exits the cranium through the hypoglossal canal, and then it travels through the anterior and lateral neck, okay? So I'm going to highlight this on the photograph down here, and it's coming out of the skull right around there. We don't really see it here, but then it travels down inferiorly like so through the anterior neck, and then it is going to jump up deep to mylohyoid. So we say that a lot, goes deep to mylohyoid. Here's mylohyoid right here, and there it is running deep to get into the oral cavity. Once it's in the oral cavity, so we're over here now, and I'm going to trace it as it comes in. Mylohyoid has been removed in this picture, so we're just seeing this come in. And note that it approaches the tongue from a very inferior angle. So inferior to all of these muscles. That's how it gets its name. Hypo meaning under, glossal meaning tongue. And from here, then it can send up little fibers to most of these muscles. And in particular, it is going to be innervating hyoglossus, genioglossus, and styloglossus. Palatoglossus is the exception muscle here. And this is because it originates from the soft palate. All right, so it shares its innervation with other soft palate muscles. And the soft palate sits mostly in the pharynx, right? It has the pharyngeal innervation pattern So Palatoglossus is going to be getting its motor innervation from vagus. That's our only exception here. All right. Those are the intrinsic and extrinsic muscles of the tongue. And here is your practice question. During active protrusion, your patient's tongue deviates uncontrollably to the right. A motor deficit for which muscle would produce this position? All right, the answer here is B, the right genioglossus. So we're looking for which side the deficit is on. If your patient does not have a functioning right genioglossus, only the left will contract, right? So if you fire your left genioglossus, your tongue will still protrude, but it will also deviate uncontrollably to the. All right, I want to show you why this happens. So very often when we show you genioglossus, we show you this view over here on the left, and we can see its fibers coming off those genial spines and kind of fanning out into the tongue. But what this view tends to leave out is the angle that these actually come at the tongue from. So over here on the right, I can make my origin right here, and the fibers of this are actually fanning out like so, okay? So if this fiber is over here, it is going to pull the tongue in this direction. All right, so this is your patient's left side. If your left side is firing, it pulls the tongue out and down to the right. All right, so that is what produces that kind of odd contralateral movement like that. And with that, we have reached the end of this module. Thank you very much for joining me.